Welcome, my name is Caroline and today's webinar is an introduction to the NIR Immunisation Schedule changes for 2017 in Medtech32 version 22.9, which take effect from the 1st of July 2017. On the schedule selection page, you will see a number of new additions. 1. Childhood Immunisation Schedule 2017. 2. Baby of Hep B positive mother 2017. And 3. A variety of standard catch-up vaccines for 2017, which are listed here. Pneumococcal vaccine. 13-valent pneumococcal vaccine, PCV13, has been replaced by 10-valent PCV10 vaccine, as you can see in this childhood immunisation here. Pneumococcal at 6 weeks, 3 months, 5 months and 15 months is now 10 as opposed to 13 previously. In an instance where the practice wishes to use existing stocks of PCV13, the vaccines can be administered this way. If we go to this child's 3-month immunisation vaccine group and we select the first vaccine as given, the second vaccine, the pneumococcal 10, we want to give the 13, so we will select alternative given, which will allow the pneumococcal 13 to pop up automatically, which will now be given. And the final vaccine in that group. PCV13 will still be available as a valid alternative to the new PCV10 vaccine. Rotavirus. Under the Childhood Immunisation Schedule, there are 3 doses of rotavirus pentavalent vaccine in the schedule. This has now been replaced by a 2-dose rotavirus monovalent vaccine schedule. There is an exception where the patient has already started the rotavirus pentavalent vaccine schedule and will still require a 3rd dose to complete. This can be given in this scenario. So this child has had 2 doses of rotavirus, whether it's rotavirus mono or rotavirus pentavalent. So we want to give a 3rd dose in the 5-month immunisation schedule in the vaccines. So we select the 5-month and we will give the 2 doses of immunisations that are appropriate here. And OK. And go to all immunisations and select a new vaccine, which will be rotavirus mono or rotavirus pentavalent at 5 months, whichever is appropriate. And we can write in here 3rd dose given rotavirus and OK. And that will note that 3rd dose has been given here. A child will not be able to receive a rotavirus monovalent if they're older than 14 weeks and 6 days. If the child is older than 14 weeks and 6 days and has not received their 1st dose of rotavirus, both 1 and 2 doses will be auto-updated with the outcome of closed, not required. We look in this child here, that's exactly what we will see. Closed, not required, because while she's 7 months, she has not started her rotavirus course. Varicella. Funded access to varicella vaccine has been widened to include 1 dose for primary vaccination in children at 15 months. And for previously unvaccinated children turning 11 years on or after the 1st of July 2017 who have not had a previous varicella infection. So as part of the 2017 schedule, varicella is available here in the 15-month immunisation group. Also available for an 11-year-old under all immunisations, new varicella 11 years pops up, and that can be given. Okay. Human papillomavirus 9 valent vaccine HPV-9 is now scheduled with the childhood immunisation schedule and not as a standalone vaccine. If we go back into our young child, you will see that HPV-9 is now part of the vaccine schedule here. As per the Ministry of Health guidelines, based on the child's age and intervals between doses, the total number of HPV doses may vary. High-risk vaccines. New high-risk vaccines have been added. These include Hib, PCV13, MenB, and Hep B, both adult and pediatric. These vaccines will message to the NIR irrespective of age. There is now an increase in the dosage interval period between 23 ppv dose 1 and dose 2, from 3 years to 5 years. This can be seen in setup, recall screening, vaccine group. If we open the 23 ppv1, you'll see it's given at 2 years, and opening 23 ppv2, you'll see it's now due at 7 years with an interval of 5. Transitioning patients. When your practice upgraded to Medtech32 version 22.9, an automatic transitioning utility was run when the first person logged on after the upgrade. This transitioned all eligible children from 2014 schedule to 2017. Children aged less than 6 weeks, i.e. 5 weeks and 6 days, automatically transitioned to the new 2017 schedule. Also, children who are due or overdue their 6-week, 3-month, 5-month or 15-month immunisation will also be transitioned to the 2017 schedule, as you will see here with this child who began on the 2014 schedule but was automatically transitioned to 2017, where the varicella vaccine is available at the 15-month immunisation in the group here, and also the HPV-9 doses are available. A new valid alternative has been added to the 11 TTAP. In this example, we go into an older child and give the 11 DTAP as an alternative. You will see the IPV miscellaneous 11 has been added as an alternative given. All valid alternatives will now message to the NIR with no restrictions. So that concludes the webinar on the NIR changes to Medtech32, and we will now open the session up for questions. Thank you for attending.